Okay. So my presentation was on the case study Cancer Genetics, A Family in Need. And then here's a quick summary of the story. And then the complete story is part 1, genetic testing. You recently graduated from your nursing program and have begun your first year as an RN working on oncology floor in a local hospital. You're currently assigned to work with Dr. Aiken, a medical oncologist who specializes in cancer genomics. Yesterday, she performed a biopsy on a tumoral growth in the adrenal gland of her 22-year-old male patient, Lee F. She initially thought she was about doing a cheek swab or taking a blood sample, but decided to perform a biopsy to retrieve the actual cells in question. You record the following notes while Dr. Aiken takes a detailed family history from the patient's parents. Lee has a sister, Leah, age 16, and a brother, Luke, age 12. Both are healthy. Lee's mother, Grace, was diagnosed with bilateral breast cancer last year at age 44. Lee's father, Brian, and Lee's paternal grandparents are still living and have no history of cancer. Grace is the youngest of 4 children. Her eldest brother, Greg, 47, and a sister, Greta, age 49, have never had any signs or symptoms of cancer. She has a brother, Geoff, who died of leukemia at age 8. He was the 3rd child of Grace's parents. Greg's 2 fraternal twin daughters have no signs or symptoms of cancer. Grace's father, Roger, died of soft tissue sarcoma at age 35. Grace's mother, Renee, is still living and in excellent health. Roger's mother died of brain tumor at age 30. Roger was her only child. Part 2 is finding answers. You have a strong feeling that there may be a high incidence of cancer in this family that is caused by an inherited genetic defect. There are 4 generations of the family members, each presenting a different type of cancer: carcinoma, brain, breast, leukemia, and now possible adrenal. You begin to research genetic disorders that can cause adrenal cancer and that could be associated with other types of cancers. You search Genomics Home Reference with the keywords autosomal dominant adrenal cancer, and you discover 7 disorders. You rule out 2 immediately since they do not usually cause malignant tumors. When you discuss the pedigree and your suspicions with Dr. Aiken, she shares with you her concerns about Lee's 2 other young siblings, Lee and Luke, despite the fact that they do not appear to have cancer. You're worried about sharing your suspicions with Lee and Grace, but for different reasons. Grace, who is still recovering from breast cancer surgery and chemotherapy, seems very fragile, as well as distraught that her son has a tumor-like growth. If Lee did, in fact, inherit a faulty gene from her that predisposed him to cancer, you are worried about how Grace will handle this news. She seems at great risk for deep feelings of guilt and serious depression. Lee, on the other hand, is a very upbeat young man with a great sense of humor. He seems mostly concerned about improving his mother's spirits. You would dread being the one to tell him if it turns out that he has a genetic condition that will predispose him to various types of cancer for his entire life. To best communicate the pros and cons of genetic testing with them, you review different types of material available. If it turns out that Lee has an inherited gene from his mother that predisposes him to cancer, the recommendation is that the family test the 2 younger siblings. Lee and his family have inspired in you a desire to find out about how to prevent and treat this disorder. Frequent screening and checkups and the avoidance of risk factors like smoking are often advised in cases involving inherited genes which predispose a person to cancer. Part 3 is gene expression and disease. Unfortunately, the results from Lee's biopsy are in, and it appears that he has adrenocortical carcinoma. Fortunately, Dr. Aiken, who in her clinical practice also conducts research, is on the cutting edge of developing treatments for this condition. She is part of a consortium of researchers that are trying to catalog all the different genes that may be involved with adrenal cancer. This will help physicians and scientists discover drugs to target specific cancer-contributing gene products. Cancer genes can be categorized in many different ways. Dr. Aiken and her colleagues use a laboratory tool called microarrays that detect the most common genes implicated in ACC. This tool helps analyze gene expression, both over and under expressed genes, in cancer samples compared to normal tissue instead of the more genetic testing panels. DNA samples from 6 patients with HCC were analyzed, including Lee F's sample. Dr. Aiken collects the appropriate consent forms from Lee to move forward and checks the hospital policies and Lee's private insurance company to make sure he's eligible for genetic testing. The results are that Lee's pathology shows that he has a low expression of the TP53 gene, which has been shown to be the most common type of germline mutation, occurring in 72% of cases in those with ACC. Since it's considered a germline mutation, there is a higher probability that it will be inherited and also passed down to offspring. Lee has no children, but he has expressed a desire to have children in the future, and this news gives him a new perspective on his future. Part 4 is gene therapy. Despite the trying to maintain a professional emotional distance, you become attached to Lee and his good-natured family. You spend evenings searching the medical literature for potential treatments, including clinical trials, to help them. You discover that there's been a gene therapy trial involving TP53. For various reasons, however, the treatments have not been approved by the FDA and the trial stalled. The main problem appeared that the company developing the treatment did not provide enough evidence that the FDA that the treatment was effective. Regardless of the FDA not approving this clinical trial, you speak to Lee and his family about the probability anyways. Lee and his family hope for the future for gene therapy will cure this disorder. Dr. Aiken meets with the family and learns that they've been made aware of the potential future clinical trials and treatment options by the nurse first. She sets up a follow-up appointment for Lee, as well as the appointment with the genetic counseling department. She then helps Lee's mother, Grace, set up an appointment to learn if she is a carrier for the TP53 mutation. She is eligible for genetic testing, and the decision is up to her whether she wants to find out the answer. Dr. Aiken recommends that the two siblings, Luke and Leah, also receive genetic testing so preventative measures can be taken if they are positive for the TP53 mutation. So here's some background on the information discussed. So at first I was unsure what adrenocortical carcinoma was, so I thought it would be important to look it up. Adrenocortical carcinoma is a cancer where the cancer cells are on the outer layer of the adrenal glands, which are on top of kidneys. Most of these tumors can make the adrenal glands make more hormones than normal, and this can cause symptoms to show up in the body. These hormones include cortisol, aldosterone, testosterone, and estrogen. Some symptoms that may occur from these being too high could include weight gain in the face, high blood pressure, and fine hair growth on the upper body. The 5-year survival rate is 51%. I was also wondering about the TP53 gene. This is a tumor suppressor gene that normally stops damaged cells from spreading. However, when the gene is mutated, it cannot stop the damaged cells, and the cells divide uncontrollably, and this can lead to tumors and cancer. This mutation of the TP53 gene is found in many cancers. Okay, so for the ethical dilemmas, there were a few ethical dilemmas in this case. In terms of beneficence or to do good, the nurse almost showed paternalism or not respecting the patient's autonomy. She did not want to tell Lee and his mother about the possibility that he may have the inherited genetic defect because she thought that the mother was too fragile and did not want to make the family upset. However, the news was not actually hidden from them. For non-maleficence, I felt that Dr. Aiken took an unnecessary risk. To do the genetic testing, Dr. Aiken could have just done a cheek swab or taken blood, but she decided to do a biopsy instead. She could have caused harm instead of doing no harm. For autonomy, or the ability for a person to make their own decisions, I thought it was strange that the mother was involved in every aspect of the story because Lee seemed to be mentally capable and legally competent. It would not need the mother there. This seems that it invades his right to privacy. Also, had the nurse not shared the information with Lee that she was thinking about doing, this would have threatened his autonomy because he would not know everything that he needs to know to make decisions about his health care. For justice was also involved because Lee could only have the genetic testing if his insurance approved it. This would impact his care, and it would not be fair if he was not allowed to get the testing due to the fact that his insurance company did not approve. So under medical indications, we need to know the patient's medical problems and the goals of treatment. Lee has an adrenocortical carcinoma and shows a low expression of the TP53 gene. This condition is chronic and has a 51% 5-year survival rate. The goals of the treatment are to cure this disease and also see if his family has the genetic mutation as well. Medical treatments are not indicated if they would be considered futile, such as with recurrent adrenal cancer. For treatment, it depends on what stage it is. If it is stage 1 or 2, they can usually just remove the adrenal gland. With stage 3, they may also move the kidney near the tumor and also part of the liver. For stages 1, 2, or 3, they may also do radiation or give mitoxantrone. With stage 4, they would do all of this and also give chemotherapy. They would also do this with recurrent adrenal cancer, or they may give medication to treat pain to help with the quality of life. Under patient preferences, we are looking at if autonomy is being respected. We need to know if the patient's informed and has given consent. In the first part of the story, it's unclear if there was informed consent for the biopsy. However, before the genetic testing, consent is given, and Lee is mentally capable and legally competent to do so. Lee also wanted to be treated for his ACC because he wanted a cure. If he was unable to give consent, a surrogate would need to be named by the patient or family member, and this surrogate would make the decision. In this case, the surrogate, if necessary, would probably be his mother. Under quality of life, if Lee does not do any treatments, his cancer would get worse and he could die. However, if he does the treatment, he may also die. It is not FDA approved because it is not considered effective. However, he wants to do this trial because it might cure him. Based on this in the previous slide where I discussed the treatment options, it seems that his cancer is probably a stage 4. If he gets to a point where he cannot make his own decisions, it makes sense that his mother would make the decisions for him at that point because she has been with him the entire time. The mom would take into consideration how her son would respond when it came to quality of life, being desirable or undesirable, and she would want to know how he values quality of life and should make this decision with him now. With regard to treatment and quality of life, the provider may have biases because she is using the patient for her own research, and this may affect how she cares for them. Right now, Lee wants to do treatment and find a cure for his disorder, but this may change if his quality of life is impacted. Also, if he has thoughts of suicide, the nurse can talk to him about it. There's an unclear answer on the ethical part if someone wants to commit rational suicide. Under contextual features, there may be a conflict of interest in the case study. Since Dr. Aiken is a researcher that is doing research for ACC, it seems like she would be very invested in this treatment. We can also assume that the mother and family are interested in the outcome because she has been with him the entire time. The family would be interested as well because there is a chance they might get this in the future. The hospital may be invested because the research is being done under them. I do not think that this would necessarily be an issue because I assume that Lee would be made aware of everything while he was signing the consent forms. Also, with his clinical decisions, there does not seem to be any religious or legal issues in his case. As I previously stated, there are considerations of clinical research and consideration because he is going to take part in a clinical trial, and also his genetic testing was also being used for research. So my original perspective is that it makes sense that the family would want to do the genetic testing since they do have a high incidence of cancer in their family and that Lee has the TP53 gene mutation. Lee also wants the clinical trial because he wants to cure his condition. My alternative perspective is that it makes sense for the family not want to do the genetic testing because it's not a guarantee that they will get cancer, so they may not want to think that they might. Lee may be feeling forced to partake in the trial because the nurse is so invested in the case and may be influencing the decision. The doctor may also be pushing the treatments and tests onto the patients and the family. So for the ANA Code of Ethics application, I applied ANA provision 2.3, 2.4, and 4.3 to this case. 2.3 is collaboration and 2.4 is professional boundaries. Both of these is that there needs to be open communication, shared decision making, and 4.3 is responsibility for nursing judgment decisions and actions. This states that the nurse must adhere to State Nurse Practice Act and not practice prohibited practices, that they must maintain professional practice. The focus of these provisions were on the part of the story where the nurse looked up the treatments and told Lee about and his family about them. There are many things wrong with this. First, as mentioned in the story itself, the nurse became attached to the family and did not maintain a professional level of emotional distance. Then she told the family treatment options before the doctor mentioned them. This may or may not be in her scope of practice, however, it should be explained with the doctor. Also, by doing this, she was showing that she was not respecting the doctor, not communicating with the doctor, and not making decisions with the doctor. So my thoughts on this is that I thought the case was interesting. I thought the topic of genetic testing was really interesting. And I've met people who do not want genetic testing because they do not want to know things that might happen to them. Other people may not think that it's a good idea for the children to get genetically testing because they are young. They're also at risk for discrimination because if you do get tested, things like insurance companies can use this information against you. Personally, I do not think that I would have a problem getting tested and knowing what I might be at risk for, but I can see why someone would not want to know. I also thought the nurse was too invested in the case and made her do things that she should not have. She almost didn't want to discuss the possible diagnosis with the patient because she did not want to hurt them. She also told them about treatment that was not FDA approved and also did not share her findings with the doctor before she told them. All right. And I had some discussion questions for everyone. The first one being, do you think the fact that Dr. Aiken is involved with the adrenal cortical carcinoma research, it mentions, so pretty much, is it related to justice that she's involved with the research, but also helping him, because is it giving him an advantage? Does anyone want to answer that?
Wait, what's the question?
So there's the ethical principle of justice, and I'm asking is Lee having an advantage of being tested because Dr. Aiken is involved with the ACC research? And do you think that would be a dilemma?
I don't know. I think maybe that actually might be a good thing because I don't know, maybe if you didn't get or if they choose not to get the genetic testing, that's like their own decision, but they have like a leeway into something that could potentially help them in the future, if depending on what the results say.
Yeah. The reason why I had this as a question and not like part of my thing with the justice is because I was conflicted about it. Because like it is a good thing that he's getting the research done on him because it can help him out. But I thought it could be potentially an unfair advantage to everyone else that isn't getting tested, because it mentioned in the study that only 6 other people were involved in the study.
Oh, I see. Yeah, that makes sense. That it's probably definitely not fair to other people, but I don't know how someone could like stop that, like unless another doctor found out like, oh, this person is helping this person more, then that could probably lead to like, I don't know, court cases or something, because that wouldn't be fair to all the other patients, because you're supposed to, you know, give all patients like equal opportunity and equal care.
My next question is, do you think that the mother should have been involved the whole time? Like, do you think that impacts any of the privacy of him, or do you think it's okay that the mother was there?
I think if he was okay with it, how old is he? Like in his 20s, right?
Yeah, he's 22.
Um, I don't know. I feel like I know me personally. I'm 24, and I think like if I was in the same situation as him, I would want my mom there with me and to know.
Mhm.
I mean, I guess it just depends on what it is we're talking about. But if I got a diagnosis like that, I know I would, want my mom there. But if the mom was just like being informed without his consent, then yeah, I think that's a problem.
Yeah, I think the doctor should have had like a conversation with him initially to see if how much he wanted his mom involved in his care. And if he really wanted her, then I think that's totally fine. But if there are certain things that he wanted to keep from her or for her not to be part of, then that would have to be followed.
Oops.
I agree with everyone's point. Like, if I was a healthcare provider, I would definitely ask the patient how involved would he want his parents in his care, and if he wants them there, then they will be there. And if he doesn't feel comfortable, then I would just have to explain to the family that the patient doesn't feel comfortable with this, and if you can just step out of the room.
Yeah. And so I agree with everyone. I think he probably does want the mother there, especially like if he's about to possibly like have cancer himself and his mom's going through cancer. I feel like it's a good like support system. And I think if he didn't want her there, he'd probably tell her like, "Oh, I want you to leave while they talk to me about this." Um okay, so for my next question, it is, do you think it helps or hurts that this patient has what the doctor is researching for? So kind of like the other question I had, um, was not like an ethical thing. Do you think it's just like convenient for him that his doctor specifically is doing research on ACC?
I think that's like a good question because I feel like maybe since this doctor is so kind of like over focused on this one topic, she could kind of go over the top about it and maybe like overthink it too much and maybe give maybe not the wrong details, but too much that could lead the patient thinking about something else or lead the patient into a different like mentality about it other than focusing on like the treatment. The doctor could be more focused on like just what the disease is and maybe like psyching the patient out more rather than helping them more.
Um, I agree. So I think it like does hurt and help him because, like we were talking about, he kind of like does get the advantage that he gets to be tested, and then the fact that his doctor knows a lot about it. But then the doctor could also like be hurting him because she might be like influencing him too much about like certain decisions like in the future because she wants him to like be a certain way for her research, which would be unethical, but it could happen. Um, and then do you think or know that the nurse should have told Lee about the FDA trial? So I was unsure about this, and this is why I asked it as a question, because I assumed that it wouldn't be in her scope of practice about telling him about treatment options, but I'm not sure if I'm wrong or right about that. And then also, I was saying that it could be like a bias or like a kind of like a um like she's like pushing him or like influencing too much, like, so yeah, pretty much. Do you think or know that the nurse should or shouldn't have told Lee about the FDA trial?
Since it wasn't approved yet, I don't know if it wasn't appropriate to disclose that information because just in case the family gets their hopes up and it doesn't end up happening, I feel like in a way you kind of promise something that wasn't yet approved of, if that makes any sense.
Hmm.
Yeah, I agree with that too, Trinice. And I feel like if they do end up getting their hopes up, that could and it doesn't end up working out, that could go against like beneficence, is that the word? Because you're not doing good. You were actually like harming the patient without realizing it.
Hmm.
Yeah, I totally agree with that. And I think that the nurse probably should have discussed it with the doctor first so they were like on the same page. And because it seemed like the doctor was a little surprised that this had been discussed with the family without her awareness. So I think that would have been a good place to start for the nurse.
Do you guys think that it was out of her scope of practice to do so?
I think so, only because it wasn't FDA approved yet, and that's kind of the only thing we really have like our focus on.
Hmm. And does anyone have any like questions or comments about anything that I talked about?
Nope.
Okay. I think we're all set then.
You did a good job, Melissa.
Yeah, good job.
Thank
Good
you.
job.